In this 36-year-old female with a history of sickle cell disease, the first image, an ADC map, demonstrates focal regions of diffusion and restriction compatible with acute infarcts in the subcortical and deep white matter of the left frontal and parietal regions. The arterial spin label perfusion images demonstrate regions of decreased perfusion which do not match with the corresponding ADC map, representing the presence of an ischemic penumbra. Findings are best identified in the right frontal region, left frontoparietal region, and left cerebellar hemisphere. The postcontrast axial T1 weighted sequence centered at the level of the Circle of Willis demonstrates absence of the normal appearance of the left internal carotid artery terminus. Instead, a tangle of vessels is identified extending along the first segments of the anterior and middle cerebral arteries on the left. These findings are confirmed on the post-contrast T1 weighted sequence in the coronal plane. This patient had a prior history of multifocal cerebral infarctions in the setting of acute sickle cell anemia. These images confirm a diagnosis of Moyamoya disease along the left, anterior, and middle cerebral artery territories. Findings are also confirmed on the MR angiography maximal intensity projection reconstruction. Moyamoya disease is a result of progressive stenosis and then occlusion of the distal internal carotid arteries and their proximal first-order branches. Extensive collateralization develops at the level of the stenosis and occlusion and may result from dural vessels, leptomeningeal collaterals, and deep perforating lenticular striate arteries, as in this case. Moyamoya is classically described as a hazy-like puff of smoke on diagnostic angiography.